Underwriting support for The Andy Draper Show is brought to you thanks in part to Paison's Pizzeria. Located in downtown Medford, it's Italian done right. Give them a call at 541 772 3668.
Hello everybody and welcome to the show. We have a few special guests with us today from the VA Southern Oregon Rehabilitation Center and Clinics. My first guest is Dr. Christina Cellura, Associate Chief of Staff for the Primary Care Line. Welcome to the show, Doctor.
Thank you so much, Andy, for having me.
As always, I like to ask people what brought them to the Valley. Can you tell us what got you to the Rogue Valley?
Absolutely, Andy. I was born and raised in Florida. Born and raised in Orlando, and then I went on to do the majority of my medical training in South Florida, which if any of our guests have ever visited South Florida, it's a very different pace, a very different lifestyle. And I really struggled with being a medical provider down in South Florida because there's a high volume of patients. The medical appointment times were short, and I really didn't feel that I was given the opportunity to provide the level of care that I really felt compelled to provide. So at the time we had some friends that lived in this community, and we came a couple times to visit and fell in love with the Four Seasons and all of the great outdoor activities that this community has to offer, and moved about 13 years ago.
It's beautiful here in the Valley. I love it here too. You work with veterans. Why did you decide to come work with veterans?
Two reasons primarily. One was when I was in my residential training, I had the privilege of rotating through a couple of different VA hospitals, and I was really struck by the level of resources that were provided both to the physicians that worked there and also the resources that were available to the veterans. It's very different. The VA model and how we practice medical care is very different than how it's done in the community in a positive way, in my opinion. That's number one. And then number two is I come from a military background. Both of my grandparents served in the Vietnam War. I'm married to a combat veteran, 22 years retired. And so this is my culture, and this is sort of my calling to really ensure that the people in our community and my friends and family members are really receiving the highest level of medical care that we can provide.
Well, we thank you for that. It takes a lot of patience, especially to come from the private sector into the VA and the sector and how that actually operates. So we really appreciate you doing that.
Thank you.
When I look at your title, it has DO, and a lot of people don't understand that. Can you explain a little bit about that to us?
Absolutely. So DO stands for Doctor of Osteopathic Medicine. There's two forms of becoming a medical doctor in the United States. One is allopathic, or MD, which is what most people associate with their primary care provider. The other one is DO, or Doctor of Osteopathic Medicine. The way those two tracks vary is in that first foundational educational component. In osteopathic medical school, we tend to focus a bit more on taking a holistic approach to providing a really comprehensive medical care plan to veterans, or to patients in general. Once that foundational piece is achieved, we then mingle together and train together in our respective specialties. So DOs and MDs then take that secondary level of training together.
Okay, so in holistic, you mean that you're looking at different things to provide the outcome instead of just looking at maybe the symptom, which we have been symptom orientated in the medical field throughout the United States till recently. So a holistic approach, is that something that's bringing better outcomes and helping people get better, helping people be part of their treatment and recovery?
That's exactly correct, and I am happy to say that the VA SORCC really takes that integrative approach and more of a holistic approach, and there's a couple ways that we're doing that. One is the primary care team really is integrated with the other services. So it's not uncommon for a veteran to come to a scheduled appointment with our medical team, and after seeing the doctor or the nurse is able to identify other needs that the veteran has. And it's quite possible that the veteran then spends 20 minutes with the social worker to gain some assistance with housing needs or food needs, and then spend time with the mental health provider because they're unfortunately dealing with loss or grief from a loved one. And so we really have made a lot of strides over the last 2 years in really integrating a really comprehensive plan to provide great care for our veterans.
Okay.
The other thing we're doing, hang on just a second, the other thing we're doing is really trying to focus more on whole health. And that is really shifting gears from historically the way we've provided medical care is really driven by the doctor, right? So you have diabetes, you need to take this medication. Although the medication piece is important and the laboratory monitoring is important, we're really trying to shift gears and focus on identifying what the veterans' goals are in managing that chronic disease and how we can best support them. So that may mean that once they meet with the medical provider, they then meet with the nurse, establish a couple of what we call SMART goals, which are really short, easy to fix goals. And then they're supported during their journey on how they can meet their outcomes and how they see success in navigating their chronic disease.
Okay, so whole health, it sounds like you're saying, is driven by your client.
Absolutely.
They decide what is important, and you together decide how to get through whatever that issue is.
Absolutely.
Okay. Sometimes we don't really understand all the components of primary care. Can you kind of take us through what primary care looks like?
So primary care at the VA SORCC and primary care in general really is along a spectrum. So as a primary care provider, I have the privilege of providing really basic medical care, routine checkups. The other piece is where we spend the majority of our time is managing more complex chronic disease, and those can be the most common are diabetes, chronic heart failure, and really trying to point the veteran, make sure they have the adequate resources that they need. And then the third kind of prong to primary care is identifying the areas that we are not fully equipped to manage, and then get the veteran to that specialist to assist in the care plan. So that could be my veteran with heart failure would then need to see a cardiologist on a regular basis. So I would then initiate that care and then have frequent contact with that cardiologist so that we're all on the same page and ensuring that the veteran's needs are being met.
Okay, so it sounds like primary care is really that first contact piece.
Yes, it's often called the hub.
And inside there, issues are identified that may not have really been at the surface. If my chest is hurting or my stomach's hurting, I could be coming there just because I think I got gas, or I might be having a heart attack. And then other things can be going on, and that's how you get that initial start to better health.
Absolutely.
Is at the primary care level.
Absolutely.
Okay.
And we know that primary care is done at its best over a continuum. So we really encourage regular checkups with our veterans. And like I said, when they come for that appointment, it's really an opportunity for us to see what other areas we can better support them in.
Okay, so there's a lot of veterans that I know, and military in general, who just don't go to the VA. They get out the military, I'm done. How do they, at some point they're gonna need something. We all are gonna need some kind of help, and they're entitled to that, they've earned that. What's the process kind of to get started?
That's a great question, Andy. And myself and the mental health service line has worked really hard at really trying to reduce barriers to receive care and reduce the stigma associated with outreaching for care in the VA. Whether you've recently returned from a deployment or whether you've been home for 20 years and still really haven't mustered up the guts to head in. I can say that any veteran that is ready to make the decision to receive care at the VA can just simply show up. There is always somebody available to point them in the right direction. The first step would be enrollment and eligibility. And there's certain criteria that are needing to be met. That might change a little bit with the onset of the new Mission Act that's coming down. But as of now, they would get enrolled, and then if they had an acute medical need, that would be triaged, and we could then get them plugged in to either being assigned to a PACT team, if we have the availability. If not, then we would then get them set up with a primary care provider within the community.
Okay, because I talk to a lot of older veterans who just feel that that's not available to them. They don't know that they can come to the VA. So what I'm hearing you say is, go find out.
Absolutely.
Go to the VA, find out.
Absolutely.
Okay. You had some slides that you were showing us earlier on access to services. I know there's been a lot of back and forth between different ideas and emotions about what goes on in the VA and how providers provide service outside of the VA. And I think maybe you're the person to shine some light on that for us. So the first slide, if you bring up the first slide for us, we can take a look at that.
This is great, actually. So I do want to say, Andy, that we have made huge strides over the last 2 years in really trying to address the feedback that our veterans are providing. And I do want to touch on that a little bit more during our conversation. But I can say that the two hottest topics in regards to both primary care and mental health is really access. We strongly feel in the VA that we provide the best care for our veterans. It's comprehensive, and we really feel like we're the ones that can meet their needs from an integrative approach, being primary care, mental health. The other piece to that is not only do we feel we can do it well, we want to make sure that it's timely care, right? So we don't want our veterans waiting for weeks and weeks to receive care. So this is an interesting slide. This was actually recently published by the Journal of the American Medical Association, and it highlights the differences between VA as a whole and the private sector as a whole. And you can see here in the second row over that primary care access times to both established and new patient care are so much better than they are in the private sector. And I can say we're so grateful in our community for our private partners, because when we lack access and we don't have enough resources to go around, they are so willing to see our veterans. But I can say that we're still head and shoulders above in wait time. So our average wait time right now at the VA source is about 16 days, and that's for both veterans trying to establish new care and also veterans that are already established on a PAC team. And that is in discrepancy to other places within the community where it can be wait times till the end of July, such as Grants Pass, and then wait times at the end of May here in Medford. So we really are working hard, like I said, to not only provide really high caliber care, but to do it in a really timely fashion.
I know that makes a big difference on whether I'm going to come talk to you. If I'm feeling I need something, if I'm going to have to wait months to see you, I want to see who's going to see me the quickest to deal with it, just so I survive. So it's good to know that the VA is providing that quality. It's good to kind of have somebody outside look at it and say, okay, they are providing a quality, timely service to the veterans they serve.
So speaking of quality, Andy, that's the other slide that I gave you.
Okay.
So it was actually a third party that did compared VA quality metrics to community quality metrics, not just our community, but private sector as a whole. And it shows hands down that we are outranking the private sector in quality metrics. And what do we mean by quality metrics? Those are those things that we're all sort of tracked on, which is outcomes. So as a diabetic, just carrying that diagnosis, unfortunately, there's a higher risk for heart attack and stroke. So the recommendations or the standard of care that diabetics are on certain medications. These are the types of quality metrics that are being tracked, ensuring that our veterans with diabetes are getting the best, most comprehensive care that they can. And again, third party showing that the VA as a whole is outperforming the private sector.
I see some of those. So will you go through that first line with me, just so I understand what it's saying?
Yeah, sure. So tobacco use, as we know, our veterans, unfortunately, have a high tobacco use, whether it be smoking or nicotine. We at each, not at each visit, but at each annual visit are screening, not only asking the right questions, but getting our veterans plugged in to ensure that when they are ready to quit, even if they're not, they know who to contact and how to contact them so that we can encourage them the best way that we can so that they can stop smoking. Breast cancer screening, routine mammography, routine pap smears, routine colorectal cancer screening. We know that colorectal cancer is largely preventable if it's found early. So again, these are the types of things that we are doing better consistently than the private sector.
Okay, I know that the female veterans rarely show up. Not, compared to the males that come to the VA, they rarely show up. I don't know why that is, but I think there needs to be a shout out to them that they are welcome there to come and see if they what services they qualify and have their medical stuff done there also.
We have women's health teams at each of our locations at White City and Grants Pass and in Klamath Falls, and we have medical care provided specifically to the needs of women's health. We have a women's health medical director, we have a women's health program coordinator, so if we have any female veterans out there with any needs at all, I encourage them to contact the VA and see what resources are available, because as you said, I think that a lot of our veterans don't really know what's available to them.
Okay, just to be clear, and we went over this again, but I want to just touch on it one more time, and that's the elements of primary care inside of the VA source. So I know you told us a little bit about that. Can you just refresh me on what that is?
Absolutely. So I would say, aside from providing both the basic medical care, the comprehensive medical care, being the hub for our veterans to get them the more specialized care that they need, like I said, we're really focusing on access, making sure that that really good care is timely, that it's being not just standard of care, but above what our community providers are providing, so high quality. And then also we really are focusing on customer service, meaning not only do we want to ensure that the veterans' needs are being met, but they're overall having a really great experience when they come. So we want them to leave after every appointment and say, that was great. I not only got my needs met, but I was able to catch up, I was able to get my medications filled, and reduce the confusion that sometimes we hear happens once they leave the VA. They're not quite sure what the next steps are. We're really trying to work on that and streamline that process.
Okay, there are a lot of departments that are out there that do different things. Can you tell us a couple of those?
So at the VA source, we have a very robust mental health department, and that is partially integrated within primary care, meaning we have psychologists that are embedded in primary care and available for what we call same-day warm handoff. So if I'm a veteran and I'm struggling with the loss of a loved one, I'm struggling with chronic pain, is actually very common, unfortunately, amongst our veterans, I want to be able to finally stop smoking. These are all the things that our veterans are facing on a day-to-day basis. Mental health is embedded in primary care. Doesn't need an appointment, actually. If you're assigned to a PAC team, you can come in and be handed off to a psychologist, which is amazing. Same thing with pharmacy. We have pharmacists that work with each individual team. So if I come in and have a medication question, even if I don't really need to see my medical provider or my nurse, my pharmacist can still assist me in managing that, that need that I have. So we have social workers that can help with housing issues, food issues, transportation issues, financial issues, caregiving. We have optometry, so if you have issues with vision or you're in need of glasses, we do that. There's physical therapy, there's occupational therapy. We have prosthetics, so that if you need a knee brace or you need orthotics or diabetic shoes, we actually provide all of those services on campus, which is amazing.
I know a lot of veterans have even got reemployed from their trained and reemployed by coming to the source and being assisted in that process. Outside access is always a question. Can you address that for me a little bit?
Meaning if I were needing to see a specialist?
If you're a specialist, if I need a specialist, or say I'm living 75 miles out in the woods.
Yes.
But, okay.
Yes. So we, as I said, Andy, we always like to be the providers of medical care because we do believe we do it best. But there are definitely rules in place, and I don't want to spend too much time discussing that because those rules are anticipated to change. For those of you who have heard the Mission Act, it's a very large act that's going to cause a lot of eligibility changes and requirements, distance, travel. For the veterans' benefit, actually, that a lot of these newer rules that are coming down will make it easier, even easier for the veteran to access care. But we really try to do what is in the best interest of the veteran, whether that's having that veteran see the specialist within the community. If the care is superior within the VA, we do try and encourage that. So it really is a case-by-case basis, and the end result is a lot of that is going to change in the next 6 months.
Okay, I know that we're kind of rural here. There's a lot of specialty stuff that doesn't really happen here because those doctors and clinicians aren't in our area. So how do we manage that type of situation? And is the VA actually trying to get those people here?
Well, we would love all of the specialists here. I'll be honest though, Andy, we are a little bit challenged geographically only because we don't have a level 1 trauma center in the community. So for a lot of doctors and residents, newly trained medical providers, they want to go to a large city and do really state-of-the-art medicine. Being in a rural location, we're not an active site for those types of medical providers. So it is difficult at times to recruit people, not just in the VA, but in our community as a whole, to come and stay in Medford and Grants Pass and Klamath Falls.
Okay, I know a lot of changes have happened in, like you were saying, the last couple of years. Do you see those changes as providing more services? I know that you're not in the residential part of this, but I remember when, say you go back 20 years, there were 1,500 veterans out there, and then it came down to 500 veterans, and I think there's it's down to a couple of hundred veterans now, and I know there's a misconception in the community, especially those people who aren't in the military or don't have services or family that comes and gets their medical assistance out there, that it's still a domiciliary. So do you know anything about that part of what went on out there?
Well, I can say that the changes that were made to the residential program are really to target better outcomes for our veterans. And sometimes that does mean shorter length of stay. It's not necessarily the length of time that's provided, but it's really having more robust programming, having better equipped staff to manage those more complex needs. So I can say that the decision making behind changing the length of stay or the amount of veterans that are coming through the program was not based on numbers, it was really based on outcomes, and that the best interest of the veteran was behind each of those decisions.
Okay, and that, let's just clarify that that's residential. The catchment area for that VA, I hear somewhere around 23,000. Is that, so there's actually 23,000 visits there of people getting service, not just the couple of people we know that are residents there.
Correct.
Okay, so I think that needs to be
Yes.
known, because they're going, okay, what's the big place got a couple hundred people in there for? What are they doing out there?
Right.
So it needs to be said that actually there's a lot of outpatients and people come from different areas to do things there.
The volume through our outpatient clinics is much higher than our residential clinic. Like I said, with all those services that we provide, and we have several teams providing those services, the majority of patients coming to the VA source are coming for outpatient care.
Okay, we've got about 2 minutes left. Is there anything you'd like to add in before we
I
end?
do, Andy. In going along with all the changes that we've made over the last couple of years, what's been really pivotal in making those changes is having the feedback from our veterans. So I just want to encourage the veterans that are receiving care or that are contemplating receiving care at the VA source that we really do want to hear from you. We want to hear the good and the bad, because that's how we can effectively push change, and we don't really know how to tackle what some of the needs are, and so we're really dependent on getting that feedback. That comes in several forms now. We have a survey that may be available in your clinic. There's also something that we call V-Signals, which is an email that can come to you within a day or two of your appointment. And there's also a survey that comes in the mail. Please don't be dissuaded. It's quite long. It's 30+ questions. But we really encourage our veterans to fill that out, because that gives us a foundation of how we can do things better.
Dr. Cellura, I really appreciate you
Thank
coming
you.
talking with us today,
Anytime.
clearing some of that air up for us and focusing us in, letting us
Yes.
know we can actually go there and
Please.
have things happen.
Please.
So thank you for being
Thank
here
you.
today.